we dey always reason health for this channel. Of course, we dey get we own in-house doctor. We dey always carry different topics come, we guys do in our health. And of course, for a year and plus, we are still counting. We talk about the coronavirus, but a couple of weeks back, we decided, okay, so maybe we'll not just the reason coronavirus, because we know say get other things where they affect Nigeria, get other things where they affect the world. You say, okay, when they talk about coronavirus, so but at the same time, we still talk about some other health issues where they on ground. And today promises to be another amazing day on top of the show, because Dr. Barth is not just here alone. No. He will carry another doctor. Like himself, come inside the building to come talk about wetin dey shele every second Thursday of inside the month of March. Every 11th of March, we dey always talk about the World Kidney Disease Day. And because say Thursday na be, but doctor don reason us, okay, why can't we talk about it today? Because it's not even going to be on set on Thursday. So that means next week Saturday. Whether you go continue, I cannot tell. Whether you have something new to tell you guys, I cannot tell. But the cocoa is World Kidney Day. They talk about every 11th of March, but it will be done on the show today. And you get a certified person, in the building with time, we go the reason that. So ladies and gentlemen, I just came to come and introduce Dr. Barth. And it's not my field. Who am I? Do you understand? I'm just a matron on set. I am just, Dr. Barth, you're going to find me matron's uniform to start wearing on this set.
Yes, so thank you very much. Thank you very much for that, your intro. Good morning, viewers at home and around the world. Just like she rightly said, every second Thursday in the month of March is World Kidney Day, WKD for short, World Kidney Day. It's a joint initiative by International Society of Nephrology, ISN, and International Federation of Kidney Foundation, IFKF. Okay? It's a time that the world commemorates World Kidney Day. It's a time that we look at the challenges that kidney could pose to our health, the challenges that can occur with kidney, the number of diseases ranging from acute kidney injury, AKI, to CKD, chronic kidney disease, and oftentimes, if something is not urgently done, it could progress to end-stage renal disease, in which case the person will have to be dependent on either dialysis or could go for a kidney transplant. And we have in our studio today a consultant nephrologist and a kidney transplant specialist in the person of Dr. Theophilus Umeizudike.
Obviously, Dr. Barth is still going to do a proper introduction when Dr. Theophilus joins us for inside the studio. But basically, Doctor, are we still going to be talking about coronavirus in conjunction with?
Yes, we'll be looking at, you can agree with me that, or we've been told countless number of times, that one of the things that could make an individual have not too good an outcome, I don't want to use the word the worst outcome, is if the person has an underlying illness and then end up picking COVID disease. Of course, we do know that kidney failure or kidney challenges or kidney diseases are some of the underlying illness that could predispose someone to having a bad outcome when such a person is infected with COVID-19. But like we said, we'll have an expert in the house that will be doing justice to all of that when we come back.
Okay, so are we still going to be talking about the vaccines? Because if I have questions on that, perhaps now.
Yes. Now, I said that because some of the commercials that will be, promos that will be done during our breaks will center on vaccine. It is no longer news that Nigeria has received our first shipment of COVID-19 vaccine from COVAX initiative, courtesy of WHO and her partners. And of course, I also want to say that people have started getting vaccinated in Nigeria. The first individual that got vaccinated was Dr. Ngon Cyprian. That happened, I think, in Abuja or so.
The president and his vice will be getting there.
Yes, and a number of people, as we speak, a number of Nigerians have been vaccinated. So wait no further, get registered, and of course, you might be the next. Okay,
so ladies and gentlemen, talking about the next, I think the next appropriate thing to do right now is to go for our break. Obviously, when I come back, Slimby will not be here again, but Dr. Theophilus will be here alongside we in-house Dr. Barth. So guys, stick around with us. You don't want to miss the show this morning.
Yes.
We'll be right back.
Welcome back. Just like we said before we embarked on that short break, we have in our midst today a face that a good number of you that may have been watching Health Matter may know. I think he has been here for a couple of times. So with us in the studio today is a consultant nephrologist and transplant physician. He works with Lasut. He is Dr. Theophilus Umeizudike. So he will be talking to us about what it is, what the theme of this year's World Kidney Day is living well with kidney disease. Living well with kidney disease. So he's going to tell us what it is to live well with kidney disease. A good number of us who may have been diagnosed with kidney disease, especially CKD and end-stage renal disease, some of them may think that this is more or less a death sentence. It is not. We have in our studio today an expert that will tell us all we need to know. And it's on that note that I want to welcome you to the studio, sir. You're welcome, sir.
Thank you very much for having me, and thank you.
So what are we talking about today, sir?
Okay, so basically, we're trying to raise awareness and let people know about kidney disease. And in the context of COVID-19, it's really been quite challenging to be able to care for people who have kidney disease. So just like COVID-19 caused disruptions, it's disrupted all health care provisions all over the world. Vaccines that normally people would take at a particular time was disrupted. Surgeries that were scheduled were disrupted. People were even scared to come into health facilities to get care, and they were probably visiting pharmacies or doing telemedicine or teleconsultations to avoid exposure to the virus in the hospital environment. So in the same way, people who have kidney disease have also been impacted negatively because of the coronavirus pandemic. And it's just stands to reason that just like the disruption of all aspects of healthcare, people who were undergoing dialysis had challenges accessing care, and some came down with the infection and overcame it. Some other ones could not overcome it. All over the world, transplantation for kidney and other organs was also disrupted. So many centers actually shut down transplantation. And this is because you were not certain. Being a novel virus, it was not easy to predict if you do a transplant and you load the person with immunosuppression, that the person will be able to contain the virus if it's exposed either before or during the process of transplant or immediately after transplant. So transplantation services all over the world, not just in Nigeria, was disrupted, and people had to stop and put a stop to kidney transplantation as well as other organ transplantations. So by the time the first wave came and eased off, services resumed in many parts of the world as well as in Nigeria. And so kidney transplant is up and going again. So the coronavirus has really changed the way things are done. And being a surgery that is scheduled, we usually do testing for the potential recipient and donor, and be sure that apart from being free from other infections, they're also free from coronavirus infection before they are admitted for the surgery. And so what we do also is that we also try to make sure that we minimize the contact that they have with the environment and with potential sources that could give them that infection, by making sure that we create a clean environment for them when they are going to be admitted for the surgery. So it's been a bit of a challenge in the last 1 year plus, because I think a few days ago we talked about the first case that was reported in Nigeria. I think it was February 27, 2020, and that we're celebrating 1 year. And we are grateful to God that the numbers have not been as devastating as in some other parts of the world, because the numbers we were seeing then was really scary. and it made some people contemplate resigning from being doctors or nurses or other care pharmacies because of the threats. I mean, you see those
and the predictions
numbers
too.
Yes, the predictions that there will be corpses in the streets of Africa. But we thank God that God in His mercies has kept us, and despite our inadequacies and our not too fantastic facilities, we're able to weather the storm and be able to still provide the services that we can to the best of our abilities. Yeah.
Thank you very much. Thank you very much. That was a good one. Now, we do know that Nigeria has taken a shipment of COVID-19 vaccine. Approximately about 4 million doses, okay, have been received. As it stands, what will be the fate of people with kidney challenges or kidney diseases generally? Will this set of people be eligible to have those vaccines? If they are not going to be eligible to have those vaccines, what will be their fate? Should they wait until probably attain herd immunity?
Okay, so that's a good question. I think it actually depends on the vaccine because there are different, about 4 already in many parts of the world, starting with the Pfizer and the Moderna vaccines, which had to be stored at very low temperatures. And I felt that wasn't the one that should come to Nigeria
Africa,
because we don't have the facility to keep it from when it arrives at the airports, in the storage facilities in Abuja and Lagos. It has to go down to the local governments, and we don't have that kind of cold chain to maintain minus 60, minus 80 degrees. We don't have that.
Yes.
And so I was glad when I heard about the AstraZeneca Oxford vaccine, and I think the Johnson & Johnson one also can be stored at the normal fridge temperature. And we know that most parts of our country at least has some form of electricity that can keep fridge going, and so we can store those vaccines in almost every part of the country. And that happens to be the one that the government has taken delivery of, courtesy of the COVAX initiative. And it's heartwarming to see that at least it has arrived in Nigeria, and the first person has had his shot yesterday, and a couple of other people had. And I think the powers that be want to also show by demonstrating leadership that this vaccine is safe by taking their own today. And that's commendable. Now, coming to the question you asked about whether this can be given to people who have chronic kidney disease or living with a kidney transplant. Yes, I know that it's a bit of a tricky question. I think for now, the people who are allowed to take are people who are yet to do a transplant. I'm not sure studies have been done in those who have done transplants to take it. If somebody is on dialysis, yes, they can take it, and they can actually take the vaccine so that they're able to mount some immunity and be able to prepare. Because if they don't take it in this state, then it's going to be challenging when they have their transplant. So they need to have some immunity against the virus so that going forward, as they prepare for possible, if they're going to have a transplant, they will already have some immunity, which is what we usually advise for those that need to do a transplant. There are some vaccinations they should undergo before transplant. But after transplant, they are limited in terms of the number of vaccinations that can be done. I think the figures are not yet out on those who have done a transplant, but for those on dialysis or who are not yet on dialysis, who have some stage, maybe stage 1, stage 2, stage 3, stage 4, or even early stage 5 that is yet to start dialysis, they can have the vaccine, because that's part of what is planned by the government, by the federal government, that those that, apart from health workers and some other essential workers, they need to look at people that have chronic ailments who should be protected because their immunity may not be so strong like some other people.
Thank you very much, sir. Now, it's also a well-known fact that a good number of people that may have some kidney challenges may not be in the know that they have it. I think one study actually put the estimate at about 70 to 80% of people that may have kidney challenges may not be aware. Now, what will be the fate of these individuals with respect to this COVID-19 pandemic? Or what are the simple things? Are there simple ways that an individual, are there some signs and symptoms that an individual could see and such a person can start suspecting, could this be a kidney problem? Should I need to see my doctor or not?
Well, the early forms of chronic kidney disease is actually asymptomatic, just like hypertension and diabetes, which are the major causes accounting for over 50% of chronic kidney disease. So those two conditions actually are asymptomatic in their early form. That's why we advocate and advise people, once you get to your late 30s, 40s, make it a habit to do a full health screen on an annual basis. It won't cost you too much. If you set that aside or if you plan towards it and give yourself a birthday gift and do a health screen, that will go a long way in helping you know what your numbers are in terms of your blood pressure number, in terms of your blood sugar number, in terms of your cholesterol, your serum creatinine, your urine test. All those goes a long way in helping to detect early forms of chronic kidney disease. Because once we detect early forms of the disease, then we're able to implement some treatment. We're able to initiate some treatment. And if the treatment is initiated on time, the chances of progression from one stage to another is minimized as long as it's something that is picked up early enough. So when it is asymptomatic, it's the best time to screen. So you don't wait until you start having serious headache. Once you're diagnosed with hypertension, please take your medications. Do the other lifestyle medication, non-pharmacological interventions of reducing your salt intake, doing regular exercise, making sure you take fruits and vegetables on a regular basis, taking enough water. Those go a long way in helping you manage your high blood pressure and be able to live a healthier life, and reduces the progression from early stage. The person may just be in CKD, chronic kidney disease stage 1, reduces the chance of the person progressing to stage 2, 3, 4, and then ultimately 5, because it has been identified early enough and the person is taking treatment. And the myth about the fact that these drugs can cause side effects, of course, there's no drug that is free of side effects. Even water, if you take too much water and the person has some kidney issues, it will cause side effects. There's nothing that is free of side effects. So don't allow that hinder you, just like people are talking about the COVID-19 vaccine, that it has side effects. There's nothing that you take into the body that is free of side effects. It's for you to know the drugs that help control the numbers and keep up with it, and just see that that's a way to help regulate your body system and keep you healthy so that you can fulfill the number of your days and live well and live like just any other person, and not have to start having to take treatments that can be delayed as much as possible. Because we notice that in our environment, we notice that people come down with this challenge earlier than developed climes. And I have said that it's likely the reason for that, a number of things. Number one is the fact that we don't seek, our health-seeking behavior is not like those of developed climes, where you have a health insurance that covers most, if not all, the population. And so people are looking at how much they're going to spend to go see a doctor or to go run some tests, and they feel that, well, this is something that I cannot afford. And so they wait until something happens, or they begin to take some herbal remedies, which they don't know how these things were prepared, and they don't know the effect that this can have on their system. And by the time they've taken it for several weeks or months, and then it then damages the organs in an irreparable manner, and then they start needing dialysis so early in life. So these things are things that we should look at, encouraging in our people to see that they do health-seeking behaviors early. You do your best to try and check your urine, your blood pressure, your blood sugar, your blood kidney function test, and know what you stand. And if there's need for you to see a doctor, of course, please go ahead and do see. And thankfully, the primary healthcare system has been able to be revitalized to a certain extent. That's why they're the ones pushing this vaccine. that they can get to every nook and cranny of the country. Yeah.
Thank you very much. Now, you did mention that along the line that the two commonest causes of chronic kidney disease are uncontrolled hypertension and diabetes. And also you added, now, I want to take this question. I want to ask a straight question. What is the place of herbal concussion with respect to kidney challenges? I know you've talked about that briefly, but I want an expert opinion on this. A lot of our people are used to taking herbal concussions. We call it all sorts of names. In some parts of Lagos, I know it is called Abo, and a number of other names. Okay? Could it pose challenges to our kidneys? Thank you very much, sir.
Yes, sir. So thanks for that question. So the thing is, there has been, I won't say very limited study about herbal remedies in Nigeria, and not too many publications, but we know that some people, one of the things they will tell you when they present in the hospital and they are needing maybe dialysis, or their heart is failing, or their liver is failing, is because they have taken these herbal remedies for one thing or the other. It could just be for what they think is malaria, and it hurts the organ or organs, and they present in the emergency with organ failure. So we know that these things contribute. Now, to be able to properly identify what in these remedies is the offending agent is what we are challenged with. Like I've told some people, research funding in Nigeria is abysmal, and that's why you're not having so much coming out in terms of research that is targeted at solving problem. So if the relevant agencies are funded well, then this research can be done. I mean, it's not rocket science to be able to go to motor parks or go to certain areas where these herbal remedies are sold in large quantities and take a bit of it and analyze and be able to find what is causing it or what may be responsible for causing organ failure in our clime. It's been done in South Africa. They've been able to identify the particular ingredients in their herbal remedies that cause organ failure. So it's not rocket science. If you fund research and you devote to funding it, I mean, there are people that have been trained. They've gone out of the country, they've gotten skills, and they've come back to add value to it.
We have John from Edo. Good morning, Mr. John.
Good morning.
Do you have a question for the doctor?
Yes.
Okay, please go ahead.
Good morning, doctor.
Good morning, sir.
Yes, I'm Mr. John from Edo State.
You're welcome, sir.
Yes, I have some problem last year, August, when I woke up in the morning. Blood was coming out from my nose. I went to specialist in Benin City. So they said I have BP 250, 120.
Wow.
So after that, I was going on treatment. Then somebody now advised me to go and meet the doctor. So I went there. I went to doctor, cardiologist. So he now took a test. He said my BP is long. The heart is big. And I have some kidney issue because of the long time BP. I didn't know that I have BP for a very long time. That what he would do, the BP is supposed to be 1.5. He's not put 2.5. So he's been giving me some treatment since last year till this year.
Okay, but you're feeling better now.
I am feeling better now.
Okay, so what's the question, sir?
So, but the BP at times it will be frustrating. He never come down. Yes, he never come down. The BP is still frustrating. At times it will go to 90, 160. At times it will go to 120, 180. But I'm still taking the drugs.
You should. I'm sure doctor will have some answers for you.
Okay.
Chief, over to you, sir.
All right. So typical of what we see in emergency or clinic from time to time, people coming in with very high blood pressures because, like I said earlier, health-seeking behavior. There's no such intentions. You need to be intentional about your health and taking charge of your health. Don't blame government for everything. There are certain things that you can do for yourself. You can actually, like I said, from about the age of 30, late 30s, 40s, begin to check annually. Do a blood pressure check, do a blood sugar check, blood serum creatinine, urinalysis, and some other ones. It may not cost, it's not likely to cost you up to 10 or 20,000 to do all these. And if you do that once a year, that goes a long way in detecting early. So that figure he mentioned is quite high. That is severe hypertension. And that means it's going to be on at least 3 drugs for treating that blood pressure. It may be up to 4 or 5, but at least it will need up to 3 drugs to treat that blood pressure. So all he needs to do is to just visit his cardiologist in Benin, which he has done, which is quite commendable, and just also visit a kidney doctor. There are many of them in Benin, so he needs to also visit the kidney doctor. Sometimes we have to, in consonance with our colleagues.
Sorry, I will stop you a little. Anifowoshe from Lagos. Good morning. Good morning, sir. Are you there? Oh, I think we lost the call. You can continue, sir.
So usually we partner with cardiology to be able to give the best drugs that will help to control blood pressure and help to retard and reduce the progression of both heart and kidney damage. So that's what he needs to do. He just needs to see the cardiologist as well as the kidney doctor, nephrologist on a regular basis, and hoping that they are able to do their part to retard and reduce progression of his condition. Yeah.
Thank you very much. Now, my next question has to do with diet. Some years ago, I had to travel to India, and I was in a hospital, and I discovered that they were carrying out a research on Nigerians. Indians carrying out a research on Nigerians. Now, it became possible because of the high number of Nigerians that were coming to their hospital for kidney-related problems. Most of them were coming for transplantation. And they decided to take or to do a research with respect to what may be responsible for these kidney challenges. And one of the things they observed that it has something to do with some certain diets that we consume in this part of the world. They also discovered that some tribes in Nigeria are much more predisposed to having kidney issues than a number of other tribes. Now, as an expert, what are your impressions on all of this? But before that, let's take Paul. Mr. Paul, good morning.
Yeah, good morning.
Yeah. You're welcome to Health Matta, sir.
Okay.
So make your contribution, sir.
Okay, I just want to speak to the Dr. Umeizudike. He's my doctor, so I'm just watching the program for the first time.
Okay. Thank you very much, sir.
He's my doctor. I just want to thank him because the issue that they are talking about has a kidney disease.
Okay.
Yeah. He knows me well. Yeah, I just want to thank him because I'm following his program now.
Thank you very much, sir. I'm sure he heard you.
Yeah, he heard me, no?
Yes, sir.
All right, Mr. Paul, thank you for calling. So basically the question you asked is no-brainer, sir. I said earlier on that research helps to answer questions. So we've known from about the year 2000 that a gene was discovered in the US among African Americans called apolipoprotein 1 gene. And this gene was found in quite a number of African Americans that developed either hypertension or kidney disease or some other form of kidney disease called focal segmental glomerulosclerosis, FSGS. So it's no-brainer. Thankfully, that research has been extended to Nigeria and some other African countries to be able to define how many people who are normal or how many people who have kidney disease have this gene. And this gene has been implicated so far that is not even found in Caucasians.
Just
that is
a minute.
Something that is...
I'll pause you a little. Good morning. How are you today?
Good morning, sir.
Yeah, thank you very much.
Yes, sir. Oh, I've been listening to the health doctor now.
Okay.
I have some challenges I'm facing now, right now. When I wake up in the morning, I find it, my breathing is not that firm. Then under my feet, for me to get up from the bed and set my feet on the floor, it's a bit difficult for me. Under my feet is paining me. I'm having serious pain under my feet. Then on my knees. So I don't know. What can I do to that?
Thank you very much. The first one you said you have a bit of problem with your breathing. Did I get that correct?
Yes, sir. Yes, sir.
Okay. You need to seek for a medical attention. I think you will need to visit your doctor. The breathing issue may have to do with a number of different disease entities. I'm sure you're not asthmatic, are you?
Sir.
Okay, so that's the more reason why you need to get to the hospital. The pains on the knees, on the joints, that could be towards malaria or some other things, but a proper investigation and evaluation will need to be carried out on you to have an idea of what it is exactly. I don't want to mention that breathing difficulties are part of COVID symptoms. I wouldn't want to frighten you, but just visit your hospital. Thank you very much for calling in.
And you know what? You can go to a primary health care center. They don't charge consultation fees. Even a nearby general hospital won't also charge you a consultation fee, but they will ask you to run investigations that you need to pay for.
I think she's in Ogun State.
Yeah, they have the same thing there.
Yeah, thank you very much. Now, my next question is, the number of times someone passes urine, someone pee, will it be a pointer to an ongoing or undiagnosed kidney problem? Or what number of times should one pass urine during the day and it will be taken as normal, or during the night?
Okay, so basically it's like what you take in, you pass out. And so on the average, we expect that you should be taking in about 2 to 2.5, 3 liters per day if you have healthy kidneys. If your kidneys are not very healthy, you don't attempt to take that much. Otherwise, you're going to have leg swelling and facial swelling or swelling of the face early in the morning. So you just need to make sure that your kidneys are healthy before you go for 2 to 3 liters daily. So if you're consuming that amount, I expect that you'll be able to pee regularly. Okay? Now, if you're consuming that amount and you're still waking up in the middle of the night to urinate, then it may be that you're also consuming that amount late in the evening. So I usually advise people beyond 6, 7 p.m., don't drink much. Just take very minimal after that time. Otherwise, you will have to wake up in the middle of the night to urinate. Now, when people are waking up 2, 3, 4, and more times to urinate in the middle of the night, and they don't drink so much the evening before, preceding that night, then that can make us suspect. It could be from heart-related problems. It could also be from kidney-related problem. It could also be from prostate issues in men older than, well, in our environment, they say you should start screening from 40, even though in advanced countries it's 50 years. So it can be any of those that can lead to having to wake up in the middle of the night and have to pass urine. Some people tell me that, I have to drink water when I wake up. I tell you, you're pushing your body to do more. If you're drinking so much water in the evenings or nights, or you wake up to pee and you drink more water, you're going to wake up more. So just minimize drinking beyond that 7 p.m. and then drink minimally. Maybe you take a meal, you can take some water with it if you're taking a late meal. Yeah, which is also not too advisable because you're going to bed, you're consuming so much, and you're taking a very huge plate of Herbal or amala or pounded yam so late in the night, your system doesn't need to use that overnight. You can consume that in the morning or afternoon, but doing that at night is not too healthy. You end up having to wake up, or even you consume something like pap or take lots of tea going to bed. Of course, you wake up to pee. It's not likely to be related to any ailment. It's just your habit that you need to change a bit and be able to get back to rhythm and be able to minimize disrupting your system in the middle of the night.
Thank you very much. Now, talking about drinking water, what about alcohol? People who take alcohol and as well as smoke, are they will that predispose them to having kidney problems?
Alcohol on itself doesn't really cause kidney problem, but alcohol is known to predispose to hypertension. And hypertension, of course, is number one cause of kidney failure in our environment. So taking alcohol predisposes to hypertension, hypertension predisposes to kidney disease, and so that's the connection. But smoking on its own has been shown to be a propagator or a factor that worsens kidney problem. So smoking is not healthy. Taking alcohol is not healthy. That's the way it works, sir.
Thank you very much. Talking about signs and symptoms, what are the things that an individual should see? The symptoms an individual will see, and then the person should start suspecting, should this be a kidney problem that I'm having?
Well, symptoms, like I said, the early stage of stage 1 of chronic kidney disease, usually very asymptomatic. Also stage 2. By the time the person is getting to stage 3, they will have some form of waking up in the middle of the night to urinate. They will also notice that maybe their legs swells or their face swells early in the morning. And then they will also notice that when they pass urine, it foams. And those are things that indicate that the kidneys are not healthy. Some people, as the disease progresses, we also notice that they get tired easily. They can't climb up the stairs without resting. And then when it gets really, really bad, people can itch, they have itching. People can have very poor appetite. They can't eat and they can't keep anything down. They just throw up. And then when it's so bad, the person can actually present in coma. So someone can become unconscious and they think it's a stroke, whereas it's because the toxins that the kidney should remove has accumulated so much that the body is not able to cope anymore. So it just puts the person to coma. Yeah, so those are the chief symptoms that people should look out for. In children, however, it's slightly different. If you see a child that is having difficulty with urine or passing blood in urine, those are things that should make you
fluffy hair.
Fluffy hair, and make you know that this child is not okay. And then if the child is not able to failure to thrive, the child is eating all they can and still not growing, then so those are things that should make you worry in a child that this child is not doing well and needs to be further evaluated.
Thank you very much. I think Dere from Delta. Good morning, sir.
Yeah, good morning, Doc.
Yeah.
Good morning. I'm Jerry, calling from Delta.
Thank you very much. You're welcome to the show, sir.
I have a question for the doctor, sir.
Yeah, go ahead.
Please, you see, when I wake up in the morning, when I test my BP, it will be high. Let's say 140 to over 100. But as time goes on, around that kind 11, 12, we think we come back to normal. I don't know if there is anything that I'm doing that is not right.
Okay, so early in the morning, there's what we call the surge of the hormones. Many hormones in your body, they are getting you ready for the day. And that's why we also clamor that people should take their medications on waking up in the morning, even before you take your meal, for most of the drugs for high blood pressure, because that's when people tend to have strokes and heart attacks. So if you take your drugs early in the morning, you minimize that spike in blood pressure that tends to happen in many, if not most, individuals. So usually if you take blood pressure in the morning and you take it later in the evening, there will be a difference, because as the day progresses, those hormones that were released into your system, they've done their work and they're no longer released like they were in the morning. So usually most mornings, the blood pressures are higher, and you discover that if you've been diagnosed with hypertension, the best time to take your medication is in the morning. Sometimes we'll dose drugs to take morning and night because some people have what we call non-dipping. So instead of that time in the evening when the blood pressure should come down, theirs also rise. And that's also put them at more risk of having early morning, maybe stroke or heart attack. So it's good to know that you need to use your medications, and that will just even things out and keep the surge in the morning not so much. And as you use the medications, it tends to stabilize things and normalize your blood pressure. And for your information, when you check your blood pressure at home, usually in the clinic, when we use the old sphygmomanometer, we use a cutoff of 140/90. But the electronic meter at home is actually, the cutoff is 135/85. So anything above 135/85 with those electronic readings is actually hypertension, because they are more sensitive than the traditional sphygm we were using before, the mercury sphygm that is 140/90.
Thank you very much. The theme for this year's World Kidney Day is living well with kidney disease. Okay, now how can one live well with kidney disease when we know that the cost of running some of these kidney-related tests are enormous, the cost of doing dialysis are enormous, the cost of doing transplant are enormous? What would be the fate of people who have this challenge with respect to paucity of funds? Are there something government is doing along that line? Are there non-governmental organizations that are trying to help people who are caught up in this scenario? I'm not sure whether you have. Okay, Joe, our time is almost up, but let's have your answer.
Okay,
sir.
Let's see. So living with kidney disease and living well with kidney disease is a theme that is meant to help promote the health of people who have, maybe they're on dialysis or they've undergone a transplant. Some people, because of the different things that the kidneys cause on their body, they are not able to move around like they usually do. But what we realize is that the quality of life in the definition of the doctor is not the same as what the patient living with this condition sees things. So they see things differently. Oftentimes we are looking at improvements in their symptoms, but on their own part, they are looking at other things. Are they able to go back to work? Are they able to go back to social life? Are they able to do other things that usually they don't have to think twice before doing it? So it puts some kind of restriction on the life of people with these conditions to make them see that they don't have a freedom anymore. One person once commented that if you eat the diet or the meals that is recommended for people who are on dialysis, you'll find it very unpalatable because it's some kind of a monotonous meal and it's something that is difficult to cope with or to stay with. So what we have said, or what we're trying to promote, is that people should come together and be able to see that, look, you need to talk to your healthcare providers. You need to talk to let people know the kind of things that you think about, how we can help you better and be able to promote your health in a better way. Mm-hmm. Government is not doing so much in our climb, but we're hoping that the National Health Insurance will help to accommodate those who are doing dialysis more and not just offer a few people or a few sessions of dialysis. We're hoping, and advocacy is ongoing to see how that can happen. And then some NGOs are also coming forward to help pay for transplant services because it's quite enormous. But one thing about kidney transplant is that people should know it's not just an ordinary operation. There's needs to factor in post-transplant immunosuppression, which is what will prevent the graft from failing.
Thank you very much. And I want to give you just a minute or two to round up and then tell us, do you have anything for Nigerian masses with respect to upcoming World Kidney Day commemoration, sir?
Yeah, so World Kidney Day, like was earlier said, happens every second Thursday of March every year. And this year, we're planning not a screening on a spot in Lagos State. We are used to doing that. But this year, what we have done is to say you can actually get a blood kidney function test, a serum creatinine. In some of the laboratories collaborating with us, they may be able to also do a urine test for you. So you need to go to our social media handle, Nephrology Nigeria. It's going to be there. You can click on the form and fill it. And there's also a contact person you can speak with. Now, there are some laboratories already listed
That's
there.
the link that we have on our screen at the moment. Yeah, go ahead, sir.
So there are some laboratories listed there that you can choose the one nearest to you to go to, and that will help you to at least do a blood kidney function test. So it's going to start on Monday, March 8th, and it will be concluded on Friday, March 12. We're giving it a whole week screening so that as much as possible, people can avail themselves of the opportunities that are available in those laboratories to do screening and get tested free of charge. It's at no cost to you. All you need to do is get registered on that platform and be able to find a suitable place. Of course, they are not open-ended. They put a number to what they can do. That's why we put a contact there. You may need to contact the person to be sure that the space that the lab is offering is not yet filled up.
So first come, first serve. So viewers at home, you've heard it from the expert. If you're in doubt, you are not sure if you have symptoms that are suggestive of kidney challenges, you have an opportunity to get free tests done for you if you live in Lagos. And it's on that note that I'll be saying a very big thank you to you, sir, for coming on the show. You've done that plenty of times in time past, and hopefully we'll be able to bring you in some other time. Thank you very much. We'll go on a short break and we'll be right back.
Okay, so obviously now we sign out segment every day. Thank you to everybody who will be tuning again on top the health segment with Dr. Barth and my able self this morning. And of course, we'll say a very special thank you to our guest, Dr. Theophilus Umeizudike. I just hope you guys did not miss all of the things we then discuss, all right, on top kidney issues. But if you be miss them, hopefully go there on top of our YouTube channel so you can always watch again, just so you can learn. Doctor, thank you very much. See you guys.
Bye. Bye-bye.